Hello, my name is Nicole White. Today we'll be talking about medical anxiety. The purpose of this speech is to inform, and it's to inform my audience about why patients experience medical anxiety and how it can be managed. My thesis is medical anxiety is caused by fear, past experiences, lack of trust, and it can affect patients' health, but it can be reduced through communication and coping strategies. So imagine sitting at your doctor's office, your heart is racing, your hands are sweating, and your mind is filled with fear about what the doctors might say next. For many people, this is not just a one-time feeling. This happens every time they seek medical attention. Medical anxiety affects people, or like many people, and can prevent them from getting the care they need, which can negatively impact their health and overall well-being. Medical anxiety is caused by fear, past experiences, and lack of trust. It can affect a patient's health. It can be reduced through communication and coping strategies. I am personally interested in healthcare, and I have worked in multiple healthcare settings. I have personally seen medical anxiety and people doubting the healthcare system. I also have researched multiple credible sources to better understand what causes medical anxiety. First, I will discuss the causes of medical anxiety. Second, I will discuss the effects of it. And finally, I will discuss ways to reduce medical anxiety. Okay. Medical anxiety is often caused by fear, past experiences, or the uncertainty of why you're at the appointment and what's going to come after. Many patients fear bad diagnoses or unfamiliar procedures. According to Medical News Today, in an article published April 17, 2023, patients often feel anxiety due to unfamiliar environments and fear of diagnoses. But not knowing what will happen during an appointment can make patients feel like they're not in control, or they're in fact losing control. Past negative experiences can also increase anxiety. If a patient has had a painful or stressful medical experience in the past, they may associate like all their future visits with fear. This can cause anxiety to build up over time, and even before entering a medical setting. Then there's the lack of trust in healthcare providers, which that contributes to being another major cause. According to AZ Primary Clinic, in an article published November 7th, 2025, building trust with your doctor is essential in reducing fears. When patients feel unheard or rushed, their anxiety can increase significantly. But now that we understand what causes medical anxiety, let's look at how it's affecting these patients. Patients may avoid or delay medical care because medical anxiety can negatively affect both mentally and the physical health of patients. According to Harvard Health Publishing, in an article published April 1st, 2024, people who avoid medical care can lead to delayed diagnoses and untreated conditions. This means anxiety can actually make health problems worse over time. On the other hand, anxiety can cause physical symptoms. According to Medical News Today, anxiety can lead to increased heart rate, nausea, and difficulty concentrating. These symptoms can make medical visits even more overwhelming and uncomfortable. Anxiety can create a cycle of fear. The more anxious a patient feels, the more likely they are to avoid care. And this avoidance can lead to worsening health, which increases anxiety even more. But now that we discussed how anxiety affects people and how it could take a physical toll on you, not just mentally, but like physically, let's look at how medical anxiety can be reduced. Communication with healthcare providers is key. According to AZ Primary Clinic, in an article published November 7th, 2025, asking questions and expressing concerns can help reduce anxiety. When patients understand what is happening, the more they feel in control. Preparation of a relaxation technique can help. According to Harvard Health Publishing, an article published April 1st, 2024, techniques like deep breathing and mindfulness can help reduce medical anxiety. Bringing a support person can also help patients feel more comfortable, and then, educating yourself before you go to the appointment or after you get that diagnosis can also reduce the fear of the unknown. According to a YouTube video on medical anxiety published November 4th, 2024, understanding what to expect during a medical visit can help patients feel more in control. Which, personally, whenever I was experiencing medical anxiety when I was 12 years old and she told me I needed a major spinal surgery, I did a lot of research personally because I wanted to know what was going to happen during my spinal surgery. I wanted to know how the incision was made, how they held it open, how they inserted the rods and screwed them in, and how they closed me up, and what the healing process was going to look like, and then relatively how long it was going to take. That provided myself as a child comfort, and I realized I have done that with the 6 other procedures I have had since. Research also supports reducing uncertainty, like I said. According to National Institutes of Health, in an article published December 28, 2023, uncertainty about procedures and outcomes is a major contributor to anxiety. So first, today, I discussed the causes of medical anxiety. Second, I discussed the effects it can have on a patient. And then finally, I discussed ways to reduce medical anxiety. Medical anxiety is caused by fear, past experiences, and lack of trust, but it can be managed through communication and coping strategies. The next time you feel anxious about going to a doctor, remember that you are not alone and understand your anxiety is the first step to overcoming it and taking control of your health.